And welcome to our Farm to Home segment this morning. We have with us again Thomas McDowell. He is a registered pharmacist with Rocky Mount Medical Pharmacy.
Thank you, Sandra. Excited to be here again today, our third segment, I believe, and have really enjoyed it so far. And excited.
Well, the people have enjoyed you being here, I can tell you.
I've enjoyed sharing the information and the value that pharmacists can provide, and really excited for our topic today. I think viewers are going to enjoy it, and it's very relevant to a lot of different folks.
Absolutely.
And so
listen up. We're
going to dive in, and so today we're going to talk about nutrient depletion from prescription medications. So it's a mouthful and a lot to unpack there. So nutrient depletion, we're referring to a loss of certain vitamins and minerals that's caused by taking certain prescription medications. And as you know, all prescriptions typically have side effects, but one key point that we don't always visit when we talk about prescription medications are the nutrients that they can deplete and basically could cause a deficiency in, and that can lead to certain effects that may be a little hard to notice unless you're getting a lab value for these vitamins and minerals, or unless you're talking to your provider about it. So and it's relevant to so many people because about 70% of the United States population takes at least one prescription medication.
Wow.
And so it's something that whether you're taking just one medication or 10 or 15, it could be affecting you, and there's something you can do about it. Or at least you can look into and talk to your pharmacist about.
And that's so good to know that you can do something about it.
And so, something my grandfather used to say is there's just as many reasons to not take a prescription medication as there are to take a medication.
Right.
And so we always want to look at the whole picture and see what's best for the patient, and not necessarily just add more and more prescription medications to treat side effects from the original prescription.
Right.
So we're going to really focus on the nutrient depletion side, the vitamin and mineral depletion. And so we'll dive into some of the most commonly prescribed medications that can cause this. So, listen up, and if you're taking one of these medications, talk to your pharmacist, talk to your provider. One that really sticks out is metformin. So a really common diabetes medication that's usually the first line prescription if you were diagnosed with type 2 diabetes. Very effective drug. It helps lower blood sugar, of course, but also helps reduce insulin resistance, which means it allows your body to utilize the insulin that it's still producing more effectively. But what it can do is it can deplete your body of B12 and folate. And so B12 really critical for energy, and it can also deplete some of the other B vitamins. And so it somewhat complicated mechanism for that, but it keeps you from absorbing B12.
Right.
And you're usually getting that from your diet.
Right.
And so obviously that's a simple one where you can take some B12 over the counter and help replenish that loss of B12. So always recommend to our patients that are taking metformin to look into a B12 supplement. And while we're talking about supplements, not all supplements are created equal. So don't just grab the cheapest and easiest to find B12 off the counter, because you may find that you don't absorb that very well.
Right.
And there's different forms and different micrograms and strengths of B12, and so talk to your pharmacist about what would work best for you. And I'm a big proponent of getting a quality supplement, because these supplements over the counter are not regulated as tightly as prescription medications.
Okay.
And so there's a lot of different flavors and a lot of difference in quality and purity.
Right. So if you're walking around tired and you're on metformin, you probably just thought, I'm just tired all the time. You know,
Yeah.
I'm just tired because we get tired. But there could be a reason if
Yeah.
you're on
It
metformin.
might not just be, because of age
Yeah.
or just, well, I guess I'm going to be tired for the rest of my
Exactly.
life. And so B12 is an easy way to see if that could be the problem. And you can always get a B12 lab from your provider, but certain over-the-counter doses are not harmful. So
Right.
that's something we typically recommend. And folate is another one where you can take that over the counter. And moving to some other prescriptions, beta blockers. So your metoprolol, carvedilol, atenolol. A lot of patients take these for either heart failure or blood pressure or lowering their heart rate, and they can actually lower CoQ10, which is a natural nutrient that our body produces that some medications can deplete, essential for energy and muscle production. And so that's an easy one. CoQ10 can be bought over the counter, and that's one that I'm a big fan of because it's hard to do a whole lot without energy and,
Right.
and muscle mass and
True.
muscle production. And so if you're feeling fatigued and drowsy or getting leg cramps when you're taking beta blockers, you might want to consider a CoQ10 supplement. And I know we're throwing out a lot of acronyms and a lot of different names. You can talk to your local
Just
pharmacist
go right
about it.
into the pharmacy. Rocky Mount Medical Pharmacy, Park Pharmacy will be glad to explain this and help you.
And we really try to, if we see these prescriptions being dispensed or prescribed for the first time, we'll try to have that conversation with the
Sure.
patient up front, because not many folks know that this is something that they may run into after they start taking that prescription. And some other ones are ACE inhibitors, lisinopril, nalopril, benazepril, very common class of medications. They can also deplete the B vitamins, the CoQ10, vitamin D. And so anytime there's a prescription that's depleting vitamin D, very essential to replenish vitamin D. Vitamin D is something that I think is underlooked, and COVID actually helped us realize that it's a really important vitamin, and
Right.
it's essential for immune function, not only just bone health, which is what we're so used to
Right.
thinking about with vitamin D, but it plays a crucial role in immune support and immune function. And so I'm a big proponent of supplementing with vitamin D. And when you reach a certain age, everyone should be supplementing with some vitamin D when you're over 50 or 60.
Sure.
And that's also a lab value that you can test for.
Yeah, because they're telling us not to get in the sun as much, to wear something now. So we
And that's
need some vitamin D.
Yep. And the sun,
Gotta have it.
you can get vitamin D from the sun, so that's a great point, Sandra. And kids are not getting outside as much these days, and
That's
there's fears of skin cancer, which are very valid. But we've got to figure out a way to get vitamin D otherwise.
That's right.
And getting it through supplements or diet. And you can get it from diet through leafy greens and certain proteins, and milk is often fortified with vitamin D as well, and some orange juices are fortified.
Right.
And so the next one that is very common is our statins, so our cholesterol medications. And so if you have high cholesterol, or if you have had a cardiovascular event, you're typically going to be on a statin if you can tolerate it.
Right.
They're very effective in lowering cholesterol, LDL cholesterol specifically, and they are notorious for depleting CoQ10, which we mentioned earlier. And so if you are taking a statin and you have muscle cramps, CoQ10 could help with that.
And muscle. Now, I hear people all the time that are on statins say muscle aches, and I've had to change my medicines.
Keep rotating
so that
through all the
muscle
statins.
ache is what the CoQ10 helps.
Yep, that's right. And it's the mechanisms thought that the statin depletes the CoQ10, and that could possibly lead to the muscle cramps. And I hate to see somebody stop a statin immediately because of those muscle cramps, because there's not a ton of options out there besides the statins that effectively lower the LDL cholesterol. There's some new injections out there, but for years statins have been the go-to. And as we know, if you've had a cardiovascular event, a heart attack, or a stroke that's due to cholesterol buildup or plaque buildup, it's essential that you get that cholesterol under control,
Right.
because the statins have been shown to reduce the reoccurrence of heart attacks. And so if we can find a way around treating some of those muscle cramps, or
Sure.
with a nutrient replenishment process like adding some CoQ10, that's a much better option than just quitting the statin
Sure.
and putting yourself at risk for another heart attack or
Well,
stroke.
it's so good to know there's an option
Yeah.
to
And-
help
and-
this issue.
I think the consumers often feel a little helpless when they're, having a side effect from the medication, and either they just want to push through and think that this is what they have to deal with, or they want to stop taking the drug. And sometimes they don't tell their doctor or their pharmacist that they've stopped taking the drug. So we really try to develop a relationship with the patient so that they trust us, and they of course trust their doctor, and they can talk to us about those issues.
Right.
Because we don't want to see somebody giving up on a drug because of something
Right.
that is
Absolutely.
preventable. And so that's a big one right there, and the muscle aches is what you're going to see from that.
The end result could be a heart attack if you give up your
Yeah,
your
yeah,
cholesterol medicine. So
That's
I
exactly
think
right.
I'd rather take the CoQ10.
And the statin's one where you don't feel any different. You know,
Right.
you start taking it, you're not going to feel different, except
Right.
potentially worse from the muscle
Right.
cramps, because you're not going to know whether it worked,
Right.
because it's, unless you know that it doesn't work and you
Right.
had a heart attack.
That's right.
And so that one's one that a lot of folks say, I really don't want to take that because I don't like the way it's making me feel.
Right.
And so talk to your pharmacist about that, and talk about a good quality CoQ10 supplement that can help with that. Another one is contraceptives, birth control medications can alter the absorption of certain nutrients, magnesium, zinc, folic acid, can make you feel tired and lead to appetite loss, anemia. And so that's one where you want to talk about taking usually a really good high quality multivitamin can help with a lot of those issues. And then one of the last ones that we'll touch on is our proton pump inhibitors. So our Prilosec, our Nexiums. A lot of people take these medications. Everybody seems to have some heartburn or some reflux these days, usually due to what we're eating. Sometimes there's some other issues, whether it's a hiatal hernia or Barrett's esophagus. But if you're having to take one of those medications, the PPIs are shutting down the production of acid in our stomach. And acid is crucial for helping absorb the food that we're eating. And so if you're altering that absorption of food in the diet, you can imagine that you're going to lose access to some of those nutrients that you would be absorbing normally. And so B12, vitamin D, magnesium, calcium is one we hadn't touched on. Those might all be depleted if you're taking a proton pump inhibitor. So calcium supplementation, which you can get from milk and dairy products. But if you're not eating a whole lot of that, you may want to consider an over-the-counter supplement for calcium. And we do want to use calcium citrate. So if you've been in the pharmacy or the grocery store aisle and you're seeing calcium carbonate versus citrate, carbonate relies on acid to be absorbed. So if you're taking Prilosec, which is reducing the acid in your stomach, you're not going to absorb the calcium carbonate that you're taking.
Wow.
And so calcium citrate is what you want to take because it does not rely on acid to be absorbed. And so not only do we need to be worried about what we're losing absorption-wise from the prescriptions, but the supplements need to be absorbed properly as well.
Right.
And there's different salt forms and different flavors of those supplements, so to speak. And so your pharmacist can help guide you to the right supplement versus you just feeling like you're shotgunning it and picking something out and hoping that it works, because that's just a waste of time and money.
Well, it seems to me, Thomas, in this conversation, seems to me that a lot of people could feel a whole lot better.
Yeah.
They could just feel a whole lot better. Day to day, there's no need to go through day in and day out just, I dread getting up because I'm going to feel bad from this medicine.
Absolutely, and that's usually the question I ask somebody if they're taking, say, metformin or maybe one of the PPIs is, are you feeling just kind of tired and sluggish?
Mm-hmm.
And 99% of the time, the answer is yes. And it could be for
Wow.
other reasons. But if there's a way that we could help with that, with
Yeah.
a supplement that has little to no risk in taking, why don't we try that and see if it helps?
Exactly.
And so everybody just wants to feel better, and prescriptions help treat the problem, but sometimes they do
Right.
make us feel worse. So let's fix
Exactly.
that and make us all healthier and feel better.
Well, this has been such good information, very valuable information. The name of this is Pharm to Home. We have a pharmacist here, Thomas McDowell, that is bringing valuable information into your home, and that's what it's about. And that's what Thomas wants to do. And we thank you so much for doing this, because I learned so much this morning.
Well, I love sharing that information, and your pharmacist is a great resource. So come see us at Medical Park Pharmacy, 901 North Winstead Avenue, Suite 100 in the Medical Park building, or the Boyce Willis Clinic is what it's often referred to. Our number is 252-443-7979, and we would love to help you out and serve you.
Very good. And Thomas will be back in 2 weeks to talk to us again about, I'm sure, another great topic. We'll let you know in advance what that is. So thank you, Thomas.
All righty. Thanks, Sandra. Enjoyed it.
Yes, we did too. All right, we'll be right back with you right after this.